Hello people, this is Arpita Raj Singh, Managing Director, RKS Networks. Well, there are a lot of students who dream to become a doctor, and the moment they have this dream in their head, the first thing that comes to every student while preparing for NEET and for the competitive examination to execute the MBBS education in India, the first focus that comes to their head is the government medical college. Now, the biggest challenge with government medical colleges in India is the limited number of seats. What happens is because the limited number of seats, the government colleges are quite few in India. First and second, because of the limited number of seats, there are a lot of students who appear or compete for those seats. As a result, there are very few students across the country who may get through the government medical college, and rest of them are left with second option, which is private medical colleges. Now, when I talk about private medical colleges in India, the problem or the challenges does not decrease, instead it increases. Why I say that? Well, there are two major reasons of me making such a statement is because first and foremost is the humongous cost structure. The cost structure of private medical colleges, I'm talking about an average private medical college in India whose tuition fees start from 70 lakh rupees to 75 lakh rupees plus the captivation fees, which is way too much. And the second major reason which I wanted to express was the quality, the limited quality, the amenities and facilities that is available to the student in such humongous cost structure. Now, when we go ahead of comparing private medical colleges with the MBBS education or medical education abroad, let's say MBBS abroad, when we talk about the cost structure in MBBS abroad, it is quite very low. The cost structure starts, if I talk about average private medical college to the top-notch medical colleges in abroad, they start from 15 lakh rupees and goes up to 95 lakh rupees and above. And there is no captivation fees or there is no donation. Now just imagine, okay, there's another thing that I'd like to mention, that when I talk about 15 lakh rupees or 95 lakh rupees, this amount includes all 5 years of your living cost, tuition fees and accommodation. So just imagine you'll be completing your complete MBBS degree in 15 lakh rupees or let's say 25 lakh rupees depending upon the country or the university that you choose. Now, this was the cost or let's say the tuition fees comparison involved in MBBS education in abroad. If I talk about the quality is quite very high that they provide over there. The world-class infrastructure, the faculty member, the amenities, the facilities that is available to the students. This major thing which increases the quality control or let's say the quality of education that they provide to the students is that in MBBS abroad, in most of the universities, what happens in their MBBS degree, the last 1 year, the complete stretch, the student gets an opportunity to practice in hospitals with top-notch doctors, let's say surgeons, gynecologists, and they get hands-on experience. So 1 year in MBBS abroad, they have this clinical rotation or let's say practice year, wherein they get the chance to interact with live patients, deal with a number of situations, critical surgeries. So this is the hands-on experience that they get, which is kind of absent when we talk about private medical colleges in India. Having said that, there's another major factor which is a very kind of good opportunity that students get in MBBS abroad is that they get an opportunity to go to the most developed countries in the world, which is let's say USA, China, Germany, as an Erasmus program to practice or to go to those countries, and this is of course funded by the university where they're studying. So they can go cross borders for their practice, for further knowledges, for summer volunteership. So this is another quality that people would get when they do MBBS abroad, and it is not there in India. So in a nutshell, I just say that these are the two major constraints when we talk about private medical colleges in India and MBBS education in abroad. In India, when I talk about private medical colleges, the cost structure is very high and the quality given is very low. Wherein, if you go abroad or you pursue your MBBS education abroad, the cost structure is low and quality control or the quality given to the student is quite very high. However, Here in RKS Networks, we have a tie-up with the top universities in countries like USA, Germany, China, Philippines, Bangladesh, and many more. And we also support the students with the guidance and the complete knowledge of the place where they're going. We brief them, we conduct a seminar wherein we brief them about everything. I'll here on go ahead and tell you few tips and few points so as to why you should do MBBS abroad. The first and foremost thing is that we send students to those universities only who are MCI approved. Now what is MCI? MCI is Medical Council of India. You can visit their website and see that what are the universities that is affiliated or recognized by them. Also you can check in their website those universities, they have the higher MCI screening test passing ratio. Now, what is MCI screening test? Well, students who go MBBS, do their MBBS abroad, after the completion of their degree, they have to register themselves and give a MCI screening test. Then only they'll be eligible to give the practice in India. So our first and major motive is whoever students who approaches us or come to us, we recommend them only those universities who have a high MCI passing test ratio and only those universities who are recognized by MCI. Now second is the low tuition fees. As I have already talked about that. The next one would be there is no donation or capitalization fee, so don't worry about that. There's another very major constraint that people have about the living cost. So the student thinks, fine, my tuition fee is covered, my accommodation fees is covered, but what about my living cost or my expenditure during my tenure of my education? Well, don't worry about that. When we talk about a package, when I said that 15 lakh rupees or 25 lakh rupees, when we talk about a package, it includes your complete living cost, accommodation and tuition fees. So don't worry about that. Is there any hidden cost or something? So there's no hidden cost. Another major focus that these universities have when we talk about MBBS abroad is the advanced curriculum. They have a rich and advanced curriculum that they impart with their students. There's global job opportunities. They can practice there or here. The internship, as I said about this earlier as well, the students get to do internship or they are on clinical rotation in their last year. There's complete guidance for MCI screening test. In fact, we also tell the students or guide the students because their coaching is also available in these kind of countries. So when these students go to these countries to pursue their MBBS, they can also go and take coaching for MCI screening test. Now, when I talk about RKS Networks, we try to give every student who come to us a 360-degree help, a one-stop solution for all their international needs, and we'll wish all the students a global career ahead when you come to RKS Networks.